Hi everybody, today I'm going to be presenting to you about cancer. So I'm going to start sharing my screen right now and I'm going to go to this presentation that I have for us today. Alrighty, so today we are going to be talking about cancer. So some background and pathophysiology about cancer is it typically uses the medical term neoplasm, which this means that there is an abnormal growth of the cells and tissue. So there's two different types. There is malignant and there is benign. Malignant is typically fast growing and benign are ones that are slower growing and typically non-fatal. So cancer is a unique disease because it can originate in any organ. So basically we can have it in our lungs, our skin, we can have it in our bones, we can have it pretty much anywhere, and it can also spread to other organs. And though cancer is not yet cured, some are fatal and some are not fatal. And malignant neoplasms can outgrow original blood supply and metastasize to other parts of the body, which is typically why cancer can be considered so dangerous. So about 1.8 million new cases of cancer were diagnosed in the US in the year 2020, and cancer is the second leading cause of death in Americans, and that is about 596,000 Americans who die of cancer annually. And there are some genetic predisposes of cancer, but 1/3 of cancer deaths are due to cigarette smoking and other things like alcohol use, sexual practices, dietary, physical inactivity, and other similar traits. So about 40% of people will develop cancer in their lifetime, and it is more common in women than it is in men. And some primary symptoms of cancer is that a lot of the time early on, cancer symptoms are non-specific, such like weight loss or weight fluctuation, sickness like fatigue and nausea, and kind of just not feeling good. And so later on, when the cancer has progressed, you'll typically experience symptoms that are aligned to the type of cancer that you have. So I put, for example, if you were to have lung cancer, you would start feeling shortness of breath, probably really heavy in your chest. So this is why early detection is key to maximizing the chance of survival. So some clinical manifestations, unexplained weight loss, fatigue, pain, skin changes, mass or lumps, anemia, or any other type of those usual but unusual symptoms. We're also going to be looking for an enlargement of an organ or any type of mass or tumor on an organ. And history and physical examination is important because it kind of gives us your background on family history, social history, what you do for work, are you exposed to anything or any bad habits that might cause cancer to appear. Cancer also depends on age, gender, risk for certain cancers like breast cancer, and environmental factors also can cause cancers, like I said, being exposed to things at work. So there is different staging. There's stage 1 to stage 4, and this just depends on where it is, has it spread, how big is it, and we can find these out with x-rays, CTs, MRIs, ultrasounds. We can do lab tests like blood work, getting a full routine of history. And each cancer is unique to itself, which means it can have different stages, it can have different types of spread, and different curability. So exercise benefits to cancer. So evidence-based benefits specific to cancer is that exercise can improve fatigue that is caused by chemotherapy or just cancer-related fatigue. And a lot of the time with cancer, you'll have muscle weakness, and this exercise can help benefit this because it can help build your muscle mass back and reduce your sedentary lifestyle. It also limits the side effects of chemo and radiation because you're up, you're moving around, your brain is distracted, you're doing all this, and it just lowers those side effects because you are overall feeling better, working out, being healthy. It also, just like I said, improves your physical fitness and functional ability because you're building up endurance, you're building up strength, you're building up all these things to just feel better. And a lot of the time that evidence or exercise will have a good long-term adherence is because a lot of the time cancer patients will be in a group setting with other cancer patients or in a support group. And these are just like, you're holding each other accountable, you're feeling good, and you're going to have a long-term adherence to the program. So, like mentioned before, exercising will improve muscle mass and function, just making sure you feel better, you're being stronger, you're more physically fit. It'll also reduce inflammation, and exercise is associated with inverse relationships between regular exercise and pro-inflammatory cytokines. So just kind of reducing cancer-related fatigue. You're obviously going to get improved cardiovascular function because as you're exercising, you're going to be improving your VO2 max, and this might help reduce cardiotoxic effects. This will enhance protein synthesis. Other things will change our hormonal and metabolic regulation. So as you're exercising, your body weight will regulate, your cancer or your sex hormones will regulate and change. And then there will also be changes in growth factors, and this is tied to reducing cancer recurrence. You're also going to have improved chemotherapy tolerance because those who are exercising, exercise has actually been proven to have higher toleration to chemo doses, which means you're getting more and better treatment, and this is going to increase the chances of you destroying cancer and not getting it back. So there is acute and there are chronic exercise responses. So some acute short-term immediate responses to exercises is just limiting that fatigue, in the moment feeling better with like reduced anxiety. And you're also going to have better range of motion after surgery because the quicker you're up and moving, the better you will be feeling. And some long-term adaptations are improved muscle mass, obviously gaining endurance and strength. You're going to lower your fatigue long-term because you are more physically fit. You're going to have better lymphatic function. You're up, you're moving around, your body is fit and moving and healthy, and your VO2 max can go up, which is overall just going to improve health, and you're just going to be feeling better overall. You're also going to be having better quality of life because you have increased functionality. You can live the day-to-day life a little bit better. You might be working out with other people, so your anxiety low, your happiness is up. You have more control over yourself because you are more physically fit and you probably feel mentally fit. And so you're going to have less psychological burden, less feelings of anxiety and depression. You're also, like I said, have that social support from your doctors and from your groups and other exercise people. You're going to have a sense of community and friendship, and this just might help you feel motivated and overall increase your emotional well-being. And as you exercise, the more healthy you get, and the more healthy you get probably means you're not going to be going to the hospital as much, which means you will be saving money. And when you are exercising, you're trying to better yourself. You just become more self-efficient. You're building confidence. You're getting stronger, and you need less help. And this is just going to make you feel more self-efficient. So some contradictions that we have are kind of just from medication, from the type of cancer you have, from how you're feeling, and what is happening in your body. So some complications can be like anemia or pain and swelling in the arms and legs, numbness in extremities. So these might be from surgeries, from medications, or from your cancer. Metastatic bone disease, you're going to want to exclude weight-bearing exercises because those who experience old pain or new pain need to stop immediately, and weight-bearing might cause this issue. Post-surgical considerations, avoid loading or stressing the body and the muscles. Kind of start with a gentle stretching or stationary movements like on a bike or stretching on a mat. Radiation therapy patients should not participate in pool-based activities. There might be ports, there might be sutures, there might be other things that should not be getting in water, let alone a pool. And then anyone who is immunocompromised should not be in large facilities, exercising with groups of people. So you're going to have to stay in clean and uninfected control places. Other warning signs and red flags are people who are at risk with cardiotoxicity risk, lymphedema, chemotherapy-induced peripheral neuropathy, and people who just have sudden loss of exercise tolerance. All these things have different possibilities of causing some red flags. So medications can cause exercise effects. We need to monitor all the symptoms people are feeling. Sometimes it could be pain-free and then start experiencing pain. We could have balance issues. We could have shortness of breath, bone pain, vital sign changes. Any of these things are things we need to look out for and might have to monitor exercise. There's also certain medication that will interact differently due to exercise. So we need to be aware of all of these medications. Some things that could be caused are anemia, early fatigue, higher heart rate. We could also get a higher infection risk, so we have to watch out for public gyms. We can get lower platelet count, which is increased bleeding risk. So if anything were to happen while exercising, this could be an issue. There's also musculoskeletal changes, so exercises might be hard and cause pain and fatigue. And then certain medications cause cardiac risk, so this just needs to all be monitored while we are exercising and need to be aware of. Symptom management strategies. So if you're starting off and you're feeling fatigue, just start slow. There's no need to increase rapidly or start very heavy. You can start around 40 to 50% of your heart rate reserve. Just increase as you're ready. Gradually progress to 150 minutes a week. Use both aerobic and resistance and other activities to compensate. Monitor how you feel, anticipate how you're going to feel, and go with that. Group-based settings might help to improve your mood and accountability, increase social support, and just reduce those feelings of unwell-being. We can also avoid excessive upper limb loading. Just start really low, about 50%, and ensure proper technique and form is being used to avoid any injury or overstraining. And again, with the bone pain, if you're feeling anything, stop completely, but also don't do the weight-bearing exercises or heavy resistance. So these are my FIT principles. So for aerobic exercise, start about 3 days a week, work your way up to 150 minutes a week. Thinking about 30-minute sessions with about 60 to 80% heart rate reserve, kind of just feeling out how you feel, feelings-wise and fatigue-wise. I also do a lot of walking, cycling, stepping, and just start slow and gradually increase like we've been saying. And for resistance training, I have about 2 days a week going about 60 to 75% of your 1 rep max, lower intensity if you are feeling fatigued. We're going to aim for about 2 to 3 sets with 8 to 15 reps, and you can do body weight, you can do resistance, you can do machines, you can do light free weights, and I just have full body working all those major muscle groups. And again, increase gradually when you are pain-free and when you think you are ready to naturally progress. These are some of our exercise modifications: reduce intensity, reduce heart rate reserve, progress slowly, reduce resistant loads, do weight-bearing exercises instead of weighted exercises, resistance band instead of weighted exercise, progress slowly, or even stay where you are, use stationary equipment, and increase your rest intervals if you're feeling tired. So some equipment I recommend are stationary bikes, recumbent steppers, exercise bands, mats, yoga mats, cushions, treadmills for only walking, seated stepper, arm ergometer, light hand weights, weight machines, and stability balls. Safety precautions are avoid high-impact activities, heavy resistance, and weight bearing on affected limbs. Exercise in seated or supported positions. Avoid public and shared facilities. Stop at any sudden new pain. Avoid any exercises and movements that could increase fall or injury. And monitor all symptoms. Timeline for potential outcomes. Around 1 to 2 weeks, you might feel a little more fatigue. You might have to reduce other activities, but you're going to begin learning a self-paced routine. Around 6 to 12 weeks, you're going to feel so much better. You're going to gain more strength and endurance. You're going to have better aerobic capacity, and your fatigue will reduce. And around 3 to 6 months, you're going to reduce medical utilization. You might need less medication, less doctor visits. Your quality of life is going to be severely improved. You're going to have better physical function. You might feel more independent, and you're just going to have an overall boost in your mood. Self-monitoring strategies. So for this, you can keep track of how you feel. Are you feeling tired? Do you have shortness of breath? Do you have good vital signs? What are you feeling? What are you eating? Just track all of that. You can monitor exercise, kind of see how you're feeling, what weight you're lifting, all of that. Check in with yourself, see how you feel, see what you could do better on. And just tracking progress, both linear and non-linear. Are you having a good days? What are your training looking like? So resources for continued support. You can have cancer rehabilitation programs. You can work with your clinicians. You can have an exercise buddy or a community person, both online or in person, kind of getting with a group of people who might be feeling or going through the same thing as you are. And some goal setting, it's like we've said the whole time. Start low to go slow. Have symptom-driven goals. Just adjust on how you're feeling. Be functional. Make sure you have good goals for yourself, not others. And make sure they are achievable. Talk to your exercise professionals and your clinicians. See if the goals you're making are good. And make sure you have some confidence-building goals. And just remember that setbacks are normal and you don't need to be mad at yourself for things that if they go bad. These are the references I used. And then now we are going to go share my screen again. I'm going to go right here. We're still sharing my screen. So we're going to go here. And I believe you can still see me. And we are going to talk to our AI role play right now. So our patient today, those who have been listening, one person said, "Hi everyone, thank you for having me here today. I've been living with cancer for several years and I'm really eager to learn more about how exercise can help me. And I have a few questions and concerns that I hope you can address." Okay, we're going to do this real quick. We're going to put this here so that we can see both me and my screen. And okay, let's see. Let's do this. Okay, so first patient. I often experience pain, especially in my joints and muscles. How can I manage this pain while trying to exercise? Are there specific types of exercise that might be less painful for me? Alright, yes. So, if you're experiencing joint pain or joint pain while you're exercising, I would recommend making sure you're doing less weighted exercises and starting with stretching, starting with resistance if you're doing it. And I would also increase mobility exercises, because if you're doing heavy lifting and your joints are already hurting, your joints are going to be under a lot of pressure and it's just going to cause more pain for you. So I would recommend doing resistance exercises, mobility exercises, and even taking a couple extra days off and doing mobility, yoga, and other type of movements that can help increase your joint or limit your joint pain. That is a good question. So another one, I've heard that exercise can improve my strength and mood, but I'm wondering what kind of results I can realistically expect. How long will it take before I notice any changes? Will it really help me with my fatigue? Yes, so exercise is the best medicine that you can have. So it can improve your overall strength. So if you are weight training, even if you're starting with body weight training, the longer, more consistent you are with weight training, the stronger you will be getting. And then as you gradually feel better, more confident, and you're increasing your weight, you're going to be gaining that strength. And this can help you with your mood, because when we're exercising, endorphins are released and other types of hormones that are making you feel better. So this will help your mood. The more consistent you are and the longer you exercise, so if you start at 30 minutes and then you go to 45, an hour, when you hit that hour, you're going to be feeling great. If you've ever heard of runner's high, it's like once you get past that mile to 2-3 mile mark, you're feeling great. And this is because of everything that's happening inside your body with those hormones releasing. It will help. And if you are wondering how long it will take to see any changes, everyone is different. If you are new, you're going to see results sooner rather than if you have been in the gym or you are consistently working out. Your results might come a little bit longer, but I would aim about 4 to 6 weeks to feel it, probably 6 to 8 weeks to really see the difference, but you will be feeling it almost instantly in the moment, but for long-term results, around 4 to 8 weeks. Another question is, I am curious about the social aspect of group exercise. I sometimes feel isolated because of my condition. How can exercising in group help with my emotional well-being? Do you think it will help me feel more motivated? Yes, 100%. So you can reach out to your doctors and see if they know any rehab groups or exercise groups, or even just going into a group fitness class at a gym if you are cleared for that. You are going to feel a sense of community. You're going to meet people who have similar conditions to you, if not other conditions that are still in the same boat. You're going to have that accountability to show up, because if you're doing a group exercise, it's going to be set at a certain time in a certain place. When this happens, you feel accountable. You're going to hold yourself to it. You go, you meet a ton of people. You're going to have a couple friends that you click with, and you're going to be feeling motivated. You're going to want to show up for them. You're going to want to show up for you. You're going to have a sense of well-being because everyone in that room is in the same boat you are. You're all there to support each other. So you're just going to really have that motivation to be there because you're not alone. You're there with people who feel the same way about you, and this will help you stay committed. Last one is, I want to build my confidence in exercising, but I often feel overwhelmed. What are some small achievable goals I can set for myself to help me feel more accomplished? I always like to recommend very simple, easy goals to start. Get up in the morning, go take a walk around the block, come home. That's movement. Whether it's for 5 minutes, 10 minutes, 20 minutes, you are moving your body. So that's what I like to start with. Start with easy, movable goals. Get up, walk if you live in town or in a city to a coffee shop and walk back. Go get the mail and come back. Just start moving your body in really easy goals. If you really want something a little more advanced, I would say maybe get up, go to the gym or your rehabilitation station, wherever you are exercising, work out for about 10 minutes, take a rest. 10 minutes, take a rest. 10 minutes, take a rest. That is 30 minutes of exercising, but you're not having to do it continuously, so you don't feel like you're dying the whole time or it's extremely hard and then you want to give up because you didn't enjoy it. This way, you're doing it at small increments at a time, kind of learning how your body works.